Hi, everyone, and welcome to our Epidemiology 635 group presentation. My name is Irene, and I am in the group with Nathulia and Mingting, and we will be discussing the application of mobile technology in improving sexual health. In this project, we will be discussing the importance of our topic. We'll also be discussing the pros and cons of traditional approaches in data collection, um, as well as gathering participants and developing interventions. And we'll also be discussing the limitations behind using technology for collecting data, gathering participants, and developing interventions. I hope you enjoy.
Hi, my name is Nitula and I will be dealing with the importance of sexual health as a public health concern. So, first of all, sexual health is defined as a state of physical, emotional, mental, and social well being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health always requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of discrimination and violence. The enormous burden of disease due to poor sexual, reproductive, maternal, newborn, child, and adolescent health renders them urgent global health priorities. The World Health Organization recognizes improved sexual and reproductive health as a key pillar of overall health, empowerment, and human rights of the individual and of the sustainable and the equitable development of the societies. In addition, on other hand, many life-threatening diseases can also spread from one person to another. Therefore, it becomes very important to be aware of the activities that can lead to the onset of various health concerns. Cultural values and standards make it difficult to assess sexuality and sexual activity physiologically, behaviorally, and emotionally. Yet, it is crucial for both individual health and public health. Also, sexual and reproductive health outcomes demonstrate some of the most striking health inequities. Some communities continue to experience greater challenges in protecting their sexual health due to social, economic, and environmental conditions that put them at an increased risk for the wide range of adverse health outcomes. This is the four pillars of comprehensive public health focused inquiry and intervention in relation to sexuality. So, this model shows the key issues identified in the WHO definition of sexual health, like fertility regulation, prevention, and management of sexually transmitted infections like HIV, then sexual violence prevention, and sexual functions, including the sexual desire and arousal. The relevance of these issues to global public health were underlined by the 2018 Guttmacher-Lancet Commission on Sexual and Reproductive Health and the Rights, focusing on the role of Sustainable Development Goals in promoting specific areas of sexual health. The WHO Working Group to Operationalize Sexual Health explicitly linked these aspects of sexual health to physical, emotional, mental, and social well-being in relation to sexuality, centered within an interconnected framework of sexual health influences, including attention to human rights and positive approaches to sexuality. So, positioning sexual well being as a driver for cross cutting public health innovation challenges the structural origins of sexual inequities and requires acknowledging that the sexual well being is experienced by people in relation to context and surroundings. So, this suggests that the surveillance of sexual well being at individual and community levels is required, and thus the challenges the centrality of privacy in sexuality. The public health surveillance is well established in sexual health prevention and control. However, an extension to sexual well being refocuses such surveillance and the capacity to offer intervention into areas traditionally outside of the public health function. So, such functions might require redefinition of relationship between the communities and public health entities to create trust and full engagement while protecting the privacy. Social determinants of health have been fundamental in understanding the additional risk factors for teen pregnancy, such as being from a single parent home or living in a home with frequent family conflict, then early sexual activity, also the level of participation in volunteering or community service work, and the low self esteem. So, in this study, in 2016, adolescents aged 13 to 24 accounted for approximately two-thirds of the newly diagnosed sexually transmitted infections and 21% of the HIV diagnosis among men and women under the age of 25. In the same year, 210,000 babies were born to adolescent mothers, aged between 15 to 19. So, according to the study, the behaviors that increase susceptibility for adolescent women include limited maternal education achievement and having a mother who gave birth before the age of 20. Sexual and reproductive health disparities among the young women of color are pronounced. They represent a disproportionate percentage of the HIV infections. And although the average birth rates of teenage women in United States are down to 2.03 percentage, this percentage increases to 2.93 and 3.19 percentage for African American and Hispanic teenagers respectively. Young women of color would greatly benefit from improved sexual education. Unfortunately, they are less likely to have medical homes and receive such preventive services. A person's sexual health is affected by determinants not only at the individual level but also at more proximal social levels, including relationship, the social environment of the community, and the larger societal context. So, here is a social ecological model which portrays how a person's sexual health is affected by these determinants. Examples of factors at each level that influence an individual's sexual health are provided. The health system is highlighted due to its major impact on sexual health at multiple levels. Sexual health affects multiple domains of wellness, which manifests through the various characteristics experienced at the individual level. The sexual health and well-being are relevant to all people across the lifespan, which begins from the pregnancy, example, the maternal conditions related to sexual activity, such as like the sexually transmitted infections that can affect the fetal health through the older adulthood.
Hi, my name is Irene, and I would be discussing the limitations of traditional non technology based approaches used in improving sexual health. For this part of the project, we first wanted to identify our understanding of what non technology based approaches consisted of. We understood it as the lack of usage of mobile devices, wearable devices, or any other technology that can help improve sexual health. These devices are designed to collect, analyze, and share data in real time. So researchers are able to use this information to develop strategies to disseminate health information tailored to the target group. We identified some traditional approaches to collecting data. So data collection can be done by surveys, in-person focus groups, one-on-one interviews and observations. Each one of these approaches can be done with the use of technology like smartphones or recorders. Some non-technology based approaches to disseminating health information can be done by face-to-face interactions, hard copy information like pamphlets, flyers. These flyers and pamphlets can be left at hospitals and schools, etc. So non-technology based approaches can create a challenge, especially during the implementation of technological interventions, and disseminating health information across different communities. We see non-technological based approaches in different environments. For instance, sex education is offered in some schools through textbooks and in-person lecture. The class covers the basics of sexual health. In some schools, they offer limited to no lessons on sexual health and sex education. According to the CDC, fewer than 50% of high school students and only 20% of middle school students receive instruction on all 16 essential topics of CSE recommended by the CDC. In one review, they saw a decline in formal instruction in schools on the method of birth control, saying no to sex, STI, and HIV information. Now, on the right side of the slide, you see the 16 essential topics of CSE recommended by the CDC. Abstinence only education can cause the spread of false information, especially if untrained, unqualified individuals are providing the information to young students and providing misinformation or outright false information about contraceptives and their failure to success rates. In hospitals and clinics, healthcare workers offer short and brief descriptions on how to improve one's sexual health. They are limited to the amount of time they spend with the patient due to their fast-paced environment. So unfortunately, patients may not have all their questions answered. Questions may come up after the appointment, and patients may have to wait until their next appointment to discuss further questions. Pamphlets and flyers may be available but provide little background as to what sexual health consists of and how to properly manage one's health. Readers will have to do some research on their own to fully grasp the information on the flyers. Flyers and pamphlets may address one specific health concern, but may not address all the patient's needs. Paper information can get lost or destroyed due to different circumstances like the weather. The literacy level of the target group may not have been taken account of, and readers may have a hard time understanding the information presented. Other locations require educators and community leaders to offer education health management strategies. This can be done through in-person community health meetings, one-on-one meetings with mentors, etc. Face-to-face discussions about sexual health may be nerve-wracking, and people may not be willing to share their thoughts. Health information is constantly changing, as we see. Traditional approaches in collecting data limits the ability of researchers to continuously update the collected information. Researchers would have to conduct numerous surveys and interviews constantly over a short period of time to get the updated data, the current data. With the use of technology, researchers would have been able to update interventions with information that has been collected from devices, and they wouldn't have to rely on many qualitative and quantitative methods in a short period of time. Interventions need to be flexible and should be able to be easily adjusted to meet the needs of the population at that time. If interventions rely on flyers and face-to-face interactions, it would take some time before people realize health information has been updated. Outdated information would be harder to retract. Like, for example, we saw how with COVID-19, information constantly changed, especially during the beginning periods of the pandemic. I feel like without the use of technology, many people would still be following outdated policies and would be late to incorporate the new information into their daily lives. For example, like we saw how when COVID-19 started to pick up, a lot of the policies and a lot of the information that was put out was that the seniors were vulnerable, and then it became children that were vulnerable, and then it became just the whole population. Um, yeah. Holding face to face information sessions can be difficult. Facilitators need to keep in mind the location of the meeting. So asking ourselves, are people able to easily get to these meetings? Um, there needs to be a specific there need to be specific accommodations for the disabled, considering wheelchair accessible locations. Sign language translators should be readily available for deaf individuals during the meetings. Misinformation can spread through the community. Flyers and pamphlets are harder to monitor because anyone can put information on a paper and give it out to people. It is more challenging to trace where the misinformation is coming from, and even more of a challenge to retract the information. Researchers will not be able to identify people who receive the wrong information in a timely manner. That would definitely take time, especially if the information is being spread during face to face interactions. It will be harder for researchers to know who exactly does not have the updated information. Delivery of health information done in person has its limitations. Like I mentioned before, people would not feel comfortable talking about sexual health face to face, especially to strangers. Connecting to other members of the group may be difficult without mobile devices. They will be they will be able to talk to each other during the group meetings or outside the group meetings. They will be able to talk to each other during the group meetings, but would have to plan to meet up outside the group meetings to continue discussion. It's even more difficult for developing countries where resources are limited. They may not have the money to print constant flyers. They may not have the money to facilitate multiple meetings and multiple information sessions. The reach of the intervention won't be as far as using technology based approaches. It would most likely stay community based, in the neighborhoods, maybe cities, but it will be very hard to spread throughout the states, throughout the country, without the use of technology.
For this part, I want to discuss how the particular technology-based approaches may increase, by example, access to treatment or more effectively treat a specific disease or disorder. Technology-based interventions give real-time data can be easily adapted or adjusted. Uses algorithm can to be more tailored to be the user, easier to collect and analyze data. Using technology help reach more users by making the app accessible and available to anyone. User requirement will be identified when they make their profile. Algorithm will be based off of the user search history in the modules and frequently uses features in the app. Technology approaches like texting, emailing, electronic surveys can help gather more participants. It's better to protect adolescent privacy.
The mobile application features we found the most important are the GIS maps. This helps the users find places like clinics and support group meetings. This is done by using the user's location on their phone, or they can manually input the zip code. This is important because users, for instance, if they're in Manhattan and they want to find support groups in the Bronx, they can manually input the zip code for the Bronx. Education modules can be fast forwarded and replayed. This gives users the ability to create tailored modules for themselves based on their level of understanding on the current topics. Modules can be downloaded to mobile devices, and this allows users to have access to health information offline. Once they are back online, their app will automatically update with the newest modules. Pop-up messaging features are used to keep users informed without having to open the app. Users would have the ability to give the app permission to send pop-up notifications. Once that is done, users will see daily messages on how to manage their sexual health and will see messages on optional face-to-face or group information sessions. Touch-free features are provided to accommodate users who are blind. They are able to use voice command to open the app and navigate through the modules. And the modules will also have closed captioning for users who are deaf, so they are able to see any videos, any information in the videos provided. The application we had in mind gives users. So the app provides social and psychological support for the behavior change targeted on a weekly basis. And this can be done through social groups, social support groups, and pop-up text messaging like mentioned before. The app can also provide reminders and notifications that can be customized. Users will be able to go into their phone and determine how often they want the text pop-up notifications to show, and actually when they want it. They can choose morning, evening, afternoons, so that can be customized, and this is great for the just-in-time interventions. They can decide when they want the text to show on their phone. The app tracks the progress with before and after surveys. So the surveys will be used to determine if the resources provided address user concern and needs. We also will use the response to the survey to identify sexual health topics that may have been overlooked. And lastly, the app can provide GPS enabling that can assist in providing could assist in providing the location of nearby pharmaceuticals. This can be pharmacies where they go pick up their medication for STIs or their birth control and stuff like that. So here we are going to discuss traditional versus technological approaches. We see in traditional approaches, whether it's for collecting data, finding participants, or developing an intervention, we see that it does not require a highly skilled IT team because traditional approaches do not use technology. So we see a lot of the processes done either face-to-face or on paper through surveys and observations. The initial cost is less expensive than technological approaches because mostly it's printing or just jotting notes. It does not require mobile phones or tablets. Like I mentioned, it doesn't involve technology. It requires more manual labor. So this requires researchers and healthcare workers going to organizations and spreading the word through mouth or through pamphlets and flyers, just updating these flyers and doing manual surveys. It takes time and it takes a large amount of staff to do that. And it's hard to monitor the quality of info. So this is just when information is printed, whether the information is incorrect or it's outdated, it is harder to retract that information, and it becomes expensive to have to reprint and but to go to organizations and to just provide updated information. For technological approaches, we see that it requires a skilled IT team. This can be based on just the development of the intervention, whether it's using mobile apps or just a website. We see that a lot goes into it, especially when it comes to protecting the user's information, and a lot goes into making the features making the app highly usable and efficient. This may become expensive, especially when it comes to maintaining the privacy. A lot of companies have to invest money into firewalls and a specific team to focus on monitoring um, bugs in the app or malware. And the digital divide comes into play because we see that people who will benefit from these interventions are people who have access to technology and internet and service like that. We end up seeing that, unfortunately, the low income communities who don't have constant access to internet and devices will not get that same benefit of like interventions on the phone for sexual health. A lot of them will have to rely on paper information, and that's what makes traditional approaches good because it's affordable. It is so technological approaches are easy to adjust and update because you can just update it on the website, update it on the app, and you can easily monitor information more effectively because you will be able to edit the information directly. Only certain people will have access or have the ability to edit the information. So then researchers and organizations are able to monitor who went in and changed the information or who had access to the data, and data breaches can be minimized or limited.
Hi everyone, this is Monting. I will show you some sexual health mobile application in the market. Here are 16 popular sexual health mobile health applications in the market. Have you heard any kind of name? You can share your experience in our discussion board. Thank you. I want to introduce a sexual health for women application. The name is Rosie. You can see there are 50,000 people download it. The review is 3.9. Rosie is not only app recommended by doctors, developed by doctors and psychologists. Rosie is the first of its kind platform for the 43% of us who experience sexual concerns. Our app meets women right where they are so they can take their sexual health into your own hands. It provides personalized wellness plan. Rosie is private and secure, accessible whenever users need it. Its monthly subscription is too expensive. You can see there are 3 memberships. The highest one is $149. That's very expensive. This is the second application I want to recommend to you. The name is Sex Checker by Nice. It has higher rating and then more people to download it. This is a sex intimacy calendar. It can check your sex and sexual activities, partners, locations and durations, protection usage, and more. You can check your sex statistics, such as daily, weekly, monthly, and yearly average. And then longest streak, longest break, longest shortest and average duration, favorite activity time of day of the week. Amount protection was used. NICE keeps users' privacy and doesn't collect any private information. I want to discuss some limitations of the technology-based approaches and recommendations for future research. Some online clinical cares, such as STI mobile health apps, require a certain level of literacy and health literacy. It could have some problems for the users whose first language is not English. Therefore, mobile health applications should have more language options such as Spanish, Chinese, and their design should be user-friendly and easily understood. Secondly, privacy issues should be considered with the use of a mobile cell phone safe sex app, since users store so much personal private information in the mobile apps. What's more, because our mobile health apps focus on the sexual health field, some users are very sensitive and careful to protect their data. They refuse to use this kind of app. The research team has limitations to get accurate raw data to adjust original designs, which will influence developers to make some progress on this product. Therefore, all mobile health apps should be allowed to check, utilize, and store personal health records, especially in the sexual health field.
So these are the references that we use to create this project. A lot of the data and information that we have included on the slides are directly from these references. Thank you everyone for listening. I hope you enjoyed our project. We look forward to your questions and comments on the discussion board. And thank you for watching.